Part C, we're going to cover decongestants now. And decongestant, these are nasal decongestants. They are used to reduce excessive nasal secretions and reduce inflamed and swollen nasal mucosa. They're used for the same illnesses and conditions as an antihistamine. So for acute or chronic rhinitis, the common cold, sinusitis, hay fever, and other allergies. There are two types of decongestants. Adrenergics, which constrict arterioles. These are sympathomimetics and the largest group of decongestants. And there's corticosteroids, which decrease inflammation. These are topically applied nasal steroids, so they use a nasal spray. Both will shrink engorged nasal mucous membranes and reduce nasal stuffiness. Now, of the adrenergics, there are oral and nasal adrenergics. The oral adrenergic, most common, is called pseudoephedrine or Sudafed. The nasal is phenylephrine or Afrin or Vicks. There are advantages and disadvantages to both. Oral adrenergic decongestants have a delayed onset. They have a prolonged decongestant effect, but they are less potent than the topical or the nasal sprays. However, there is no rebound congestion when you end an oral adrenergic use. With nasal adrenergic, very fast acting, prompt onset. They're powerful, but you can use them no longer than 3 days. If you use them longer than 3 days, you will actually have rebound congestion much worse than the original. And it can cause a dry nasal membrane and bloody noses. All adrenergics constrict small vessels that supply the upper respiratory structures. As a result, these tissues shrink and the nasal secretions in the swollen membranes are reduced and better able to drain. So nasal stuffiness is relieved. But remember, adrenergic cause the arterioles to constrict. If you have high blood pressure, this is a problem. So adrenergics treat stuffiness through nasal vasoconstriction. Intranasal steroids prevent the stuffiness. They're anti-inflammatories. The two most common are Flonase or fluticasone and funicelide or nasalide. But those prevent. Once you have the congestion in your nose, those will no longer be helpful. Decongestants may cause hypertension, palpitation, and CNS stimulation, so you want to avoid these in patients with cardiac disease and the elderly. Want to avoid caffeine while using these. Administer at least 2 hours before bedtime to prevent insomnia. Push fluids, and make sure they're having a therapeutic effect. Come back for Part D. We're going to cover two types of medications, antitussives and expectorants.